Listen carefully, because what I'm about to say can save you from doing the wrong thing tonight. If your feet or ankles swell in the evening, if your socks leave deep marks, if your shoes feel tighter by dinner time, you're not just getting older. You're seeing a signal. And here's the scary part. The same swelling can mean 5 completely different causes. And the fix depends entirely on which one you have. Some causes are harmless and easy to correct at home, but one cause can mean your heart or kidneys are struggling, and that becomes dangerous fast. So in this video, I'm going to do 3 things. First, I'll help you identify which type of swelling you have in under 1 minute. Second, I'll show you the exact bedtime protocol that drains fluid overnight. Third, I'll give you the red flags that mean you need medical help. Tonight, not sometime later. I'm Dr. Claire Whitmore. And after decades working with seniors, I can tell you this. Swelling is not a diagnosis. It's a symptom, and the body always has a reason. Now, this quick safety note. This video is educational. If you have serious symptoms, you need urgent care, and I'll tell you exactly what those symptoms are in a moment. But first, the 1-minute test you can do right now. Sit down and look at your lower legs. Now press your thumb firmly into the front of your shin, right over the bone, and hold it for 10 seconds. Release. If the dent stays visible for more than about 10 seconds, that's called pitting edema. That matters because it immediately narrows down your causes. Now compare both legs. If both legs swell equally, your most likely causes are gravity swelling, medication swelling, or heart and kidney causes. If one leg is clearly more swollen, we have to think about vein problems, and in some cases, a clot. And a clot is not something you wait on. So before I teach the bedtime protocol, I need to protect you. The emergency red flags. If you have swelling in one leg only, and it came on suddenly, especially with pain, redness, warmth, or tenderness, go to emergency care now, because that could be a blood clot. And a clot can travel to your lungs. If you have swelling in both legs plus chest pain, severe shortness of breath, or you feel like you cannot get enough air, call emergency services immediately. Also, if your swelling is rapidly worsening over days and you feel unusually exhausted or can't lie flat without breathing trouble, that's a heart failure warning sign. Now, if you do enter and not have these emergency signs, good. That means we can calmly identify your swelling type and fix it correctly. The 5 types of swelling and why the fix changes. Jekers, type 1, dependent edema, gravity swelling. This is the most common in seniors. It's caused by gravity and sitting or standing too long. Clues. Worse as the day goes on, better in the morning, usually both feet equally. Your legs feel heavy, but otherwise you feel okay. This is the easiest to fix, and the bedtime protocol works extremely well for this type. Type 2, venous insufficiency, vein valve failure. Your leg veins have tiny valves that prevent blood from falling backward. As we age, those valves can weaken. Blood pools in the lower legs, and fluid leaks into tissues. Clues. One leg worse than the other, often. Visible varicose veins, aching, heaviness, tired legs, brownish discoloration near the ankles. Swelling improves a little overnight but never fully disappears. This type needs daytime compression, not just nighttime elevation. Type 3, lymphedema, lymph drain failure. This one feels different. Lymph fluid is protein-rich. And when it builds up, the skin can feel thicker, tighter, almost rubbery. Clues: swelling that feels firm. The skin may not pit much. The indentation doesn't bounce back normally, starts in the foot and slowly climbs upward. History of lymph node removal, radiation, major infection, or trauma. For this type, aggressive compression without guidance can backfire. You want a careful approach. Type 4, medication-induced edema. This is huge because it's common and often missed. Dozens of medications can cause swelling. Clues: swelling started within a few weeks of a new medication, swelling is persistent, elevation helps only a little, no big change from day to day. In this case, the real fix is not more pillows. The fix is reviewing medications with your doctor and switching if possible. Type 5, cardiac or renal edema, heart or kidney fluid retention. This is the dangerous category. Clues: swelling in both legs. Swelling goes above ankles into calves or higher. Shortness of breath. Fatigue that feels unusual. Reduced urination, or swelling around the eyes in the morning. If this sounds like you, the protocol I'll teach can reduce discomfort, but you still need medical evaluation. Now the bedtime protocol that drains fluid overnight. Here's what makes this powerful. It's not one trick. It's a 5-part system that works together. And when you do it correctly, many people wake up and say, "My ankles are back. My shoes fit again." We're starting with the 2 parts that most people do wrong. Element 1, strategic elevation the correct way. Most people elevate incorrectly. They put their feet on one pillow, and nothing changes. Here's the rule: your feet must be higher than your heart, not level, higher. That usually means your feet need to be about 12 inches above mattress level. Best option, a firm wedge that supports your legs from ankles to thighs. If you use pillows, use multiple firm ones so your whole leg is supported, not just your heels. Angle matters. Aim for a gentle slope, roughly 20 to 30 degrees. Also important, knees slightly bent, not locked straight, no pressure behind the knees, and the elevation needs to be maintained all night, because if you elevate for 1 hour and then drop your legs, the fluid returns. And here's what's happening inside your body when you elevate correctly. Gravity has been pulling fluid down all day. At night, you reverse that. Fluid returns to circulation, and your kidneys can remove it. That's why many people wake up to urinate more. That's not bad. That's your legs draining. Now, here's the next element. And this one is critical. Element 2, compression, but not during sleep. Some people wear compression to bed, and that can be a mistake. For most cases, compression is for daytime prevention. Nighttime is for drainage, so here's the correct timing. Daytime. Compression prevents fluid from collecting. Nighttime. Remove compression and elevate to drain. Now, compression only works if it's the right type. You want graduated compression. Tighter at the ankle, looser upward. For mild swelling. 15 to 20 millimeters of mercury. For more significant swelling or known vein issues, 20 to 30 millimeters of mercury. Usually with medical guidance, and fit matters. Too loose, useless. Too tight can reduce circulation. The most important rule of all, put them on in the morning before you stand up. Before gravity floods fluid down, if you walk around first and then put them on, you're already chasing swelling that has started. Element 3, the 5-minute lymphatic drain before bed. This is not deep massage. It should never hurt. You are not pressing into muscle. The lymphatic system sits very close to the skin. It responds best to gentle, slow movement, not force. How to do it correctly. Do this right before getting into bed. Start at the upper thigh. Place both hands on the middle of your thigh and gently sweep upward toward the groin. Slow, relaxed strokes. Repeat 10 times. Now move to the knee area. Sweep upward from the knee toward the thigh. 10 strokes. Next, the lower leg. Sweep from the ankle upward toward the knee. 10 strokes. Finally, the foot. Using your thumbs, gently move from the toes toward the ankle. 10 strokes on the top of the foot. 10 strokes on the bottom. Now repeat the entire sequence. 2 more times. This takes about 5 minutes total. Why this works? You are not forcing fluid out. You are opening the drainage pathways. This primes your lymphatic system so that while you sleep, fluid can move out of your legs and back into circulation, where your kidneys can eliminate it naturally. Many people notice their ankles look better within a few nights, just from this step alone. Dorit. Element 4, strategic hydration. Yes, water helps reduce swelling. This sounds backward, but it is absolutely true. When you drink too little water, your body goes into retention mode. Your kidneys hold on to fluid. Hormones that retain sodium increase. Swelling becomes worse, not better. The correct hydration strategy: drink most of your water earlier in the day, from morning until late afternoon. In the evening, reduce fluids. After dinner, only small sips if needed. Stop drinking fluids about 2 hours before bedtime. Except for medications. This keeps your kidneys working efficiently without adding extra fluid right before lying down. Sodium matters more than water. Swelling is rarely caused by water itself. It is caused by excess sodium. Processed foods, packaged meals, restaurant food, cheeses, deli meats, these silently load your body with sodium. If you want real results, keep sodium extremely low for at least 2 weeks. Many people see dramatic improvement just from this change alone. Vlineur ETH Element 5, gentle support for fluid balance. These are supportive tools, not medications. If you have heart or kidney disease or take prescription diuretics, always discuss supplements with your doctor. Magnesium in the evening can help support circulation and relaxation. Many seniors are deficient, and deficiency worsens fluid retention. Potassium from food helps balance sodium. Low potassium encourages the body to hold on to water. Focus on potassium-rich foods earlier in the day, not supplements unless directed by a physician. A critical reminder about medications. If swelling appeared or worsened after starting a new medication, that is not a coincidence. Several common medications cause fluid retention as a side effect. If medication is the cause, no amount of pillows or a massage will fully fix the problem. This is not about stopping medication on your own. It is about having an informed conversation with your doctor about safer alternatives. Now, let me give you the exact nightly routine, step by step. This is the part where everything comes together. If you follow this sequence correctly, you give your body the best possible chance to drain excess fluid overnight and keep it from returning the next day. Please listen carefully. The order matters. For the complete nighttime routine. Early evening, eat a low-sodium dinner. Fresh foods, no packaged meals, no added salt. After dinner, begin reducing fluid intake. Small sips, only if necessary. About 2 hours before bed, stop drinking fluids completely except for what you need to take medications. This prevents extra fluid from pooling in your legs overnight. Right before bed, perform the PA 5-minute lymphatic drainage. You learned earlier, slow, gentle, relaxed. This prepares your lymphatic system to move fluid efficiently while you sleep. After that, take any evening supplements your doctor has approved, such as magnesium. Getting into bed. This is critical now. Elevate your legs higher than your heart. Not level, higher. Your feet and lower legs should be supported from ankles to thighs. Your knees should be slightly bent, not locked. The elevation should be comfortable enough that you can maintain it all night. This is not a short treatment. This is sustained drainage. If you lower your legs halfway through the night, most of the benefit is lost. What happens while you sleep? As you rest, gravity finally works in your favor. Fluid that has been trapped in your feet and ankles all day moves back into circulation. Your kidneys filter it. Your bladder fills. If you wake up needing to urinate more than usual, that is not a problem. That is success. You are eliminating the fluid that was causing the swelling. In the morning, do not skip this step. Before standing up, put on your compression stockings while you are still in bed. This locks in the progress you made overnight and prevents fluid from rushing back down into your ankles. Then stand up and begin your day. How long until you see results? Most people notice visible improvement within a few days. Shoes feel looser, ankles look more defined, legs feel lighter. Significant improvement usually happens within 2 weeks, with continued progress over several weeks. Consistency is everything. Doing this occasionally will not work. Doing it nightly will. On when swelling is not normal. Warning signs. I need to say something very important. Not all swelling is safe to treat at home. If you have sudden swelling in one leg, especially with pain, warmth, or redness, this could be a blood clot. This is an emergency. Seek medical care immediately. If swelling is accompanied by shortness of breath, chest pressure, or extreme fatigue, this may be heart-related. Do not wait. Get medical help. If swelling worsens rapidly over a few days or spreads above the knees, this needs evaluation. The protocol I've given you is for chronic, gradual swelling without emergency symptoms. When in doubt, always choose safety. Why this matters. More than comfort. Swollen feet and ankles increase your risk of falls. They change your balance. They reduce sensation. They force you into poorly fitting shoes. Falls are one of the leading causes of hospitalization in seniors. Reducing swelling improves mobility, confidence, and overall quality of life. This is not cosmetic. This is functional health. Fracture final message. Your body is not broken. It is responding to gravity, circulation changes, and often medications. When you support it correctly, it responds quickly. Tonight, you have a clear plan. Follow it fully. Be consistent. Give it time. And if swelling does not improve, that is valuable information too. It means you need medical evaluation. In the next video, I will explain the most common medications that quietly cause swelling and what safer alternatives to discuss with your doctor. Take care of yourself. Your legs carry you through life. They deserve attention now.